It has been a whirlwind of events this month. Lots going on. I hope that you all had a chance to look at our monthly newsletter. As you all know, and I'm guessing many of you are still in a celebratory mode, we actually finally repealed the Sustainable Growth Rate and have the new Medicare Access and CHIP Reauthorization Act of 2015. So lots of excitement around that, and certainly we are thrilled by all the potential that there exists within that, certainly as it relates to primary care and patient-centered medical home. As many of you probably know, the patient-centered medical home was named as one of the avenues that practices can use to enter into these alternative payment arrangements through Medicare. So lots of very exciting things going on around that, and much more to come as we really try to realize everything that's included in that legislation. In addition to what's going on at the national level, lots of activity certainly happening at the state level as well. We also just recently launched a new state legislation page that I would encourage you to go onto our website to visit. It does a really great job of tracking all the state and federal health policy information, most specifically the legislative action that's being taken in states to support the patient-centered medical home and primary care delivery models. So there's information in our newsletter on how to access that page as well. Before we get into our presentation for today, just a couple other reminders. We have certainly a lot of interest in our upcoming CAPG pre-conference that we're doing out in San Diego on June 11th. If you haven't already signed up for that, I encourage you to please go onto the website. We've included a link to that as well in our newsletter. Register for that. We're so excited to be partnering with CAPG this year, as we told you before. We've got a lot of primary care practitioners and partners who are going to be in attendance. So especially for those of you and your colleagues who are out in the west side of the country, this is a great opportunity to participate in both a PCPCC and a CAPG event. So we look forward to seeing all of you who've already registered out there. And then just one other reminder that we have released our final chapter of our 5-part podcast series on interprofessional training in primary care. It's one of those listen at your leisure. Go onto our website. You can download them all together. You can listen to them one at a time. But lots of great information there, and certainly incredible activity that's happening on that particular front as we're working to train our healthcare professional workforce in a very different way to work in team-based environments. So just to remind everyone again, if you're participating in the presentation today, we do not make it available for you to do a live audio question, but throughout the presentation we encourage you to type in your questions. And then at the end of the presentation, I will be asking those questions of our presenter. So again, at any time during the presentation, if a comment or a question arises, just go ahead and type that into the question box. We're also going to do some interactive technology with you today. We've got several polls that we're going to ask you to participate in. So have your mouse at hand or ready to click through as we talk about some of the experiences that you've had and and posing some questions to you about the role of consumers in this new healthcare environment. So without further ado, I am going to turn it over to our presenter today, Lynn Quincy. Lynn Quincy is going to talk about the new Healthcare Value Hub that was launched by Consumers Union. Consumers Union is the advocacy arm of Consumer Reports, and this Value Hub is a networking and resource center for advocates working for lower costs and better value in healthcare. Funded by the Robert Wood Johnson Foundation, the Healthcare Value Hub supports and connects consumer advocates across the country and can provide comprehensive research-based information and tools to help them in their advocacy efforts as they're working towards policies that reduce healthcare costs and increase quality. Lynn obviously is with Consumers Union, and she's worked on a wide variety of health policy issues there, focusing primarily on the areas of consumer protection and health insurance reform at the federal and state levels. So Lynn, I'm going to go ahead and turn it over to you for your presentation.
Amy, thank you very much for that very kind introduction. I'm very pleased to be here today. Without any further ado, let's go ahead and get started. I'm going to tell you all about the Healthcare Value Hub today and hopefully say a few provocative things in order to get everyone listening today to send in a couple questions. So this is a picture of me because it's always nice to have a sense of who it is that's talking with you. But even more important, Amy already teed this up, but it's not everyone realizes that Consumer Reports, that magazine that you know and love, actually has a whole arm that does policy and advocacy work. We consider that part of our mission to keep consumers safe in the marketplace and fully informed. The Healthcare Value Hub is a brand new center, and as Amy already said, it monitors, it synthesizes, translates, and disseminates evidence about the interventions that are intended to improve value for our healthcare dollar. And our primary mission is to support and connect consumer advocates across the U.S. to help them advocate for change, that change towards that better value for our healthcare dollar. But you're going to hear more about that. So let's talk about why Robert Wood Johnson Foundation has funded this new project that we use the shorthand of the Hub. Well, as everyone on this call knows, high healthcare costs and poor value have been a policy concern for literally decades. There was a lot of discussion about this in the 70s, back when healthcare spending as a percent of GDP was just 8%. More recently, despite our concerns, this has grown to be 17% of GDP, and we expect within a decade that it will be 1/5 of spending in our economy will represent healthcare spending. That wouldn't be a problem if we were getting a good value for all that spending, but I don't think anyone on this call believes that we are consistently getting a good value. We know there's unwarranted variation in healthcare prices and variation in healthcare quality that we don't want to see. And there's too little transparency. We operate inside of a very opaque system. So you've heard me talk about how we're targeting consumer advocates. Well, it's important to understand the impact on consumer. This is a considerable consumer hardship to not only have this high level of spending, but to have that unwarranted variation that I just talked about. One obvious aspect to that is it's extremely difficult for consumers to afford the resulting premiums and then to also pay the out-of-pocket expense that's expected of them. This causes a lot of stress and anxiety for consumers. This is a top-of-mind concern for them. Healthcare is a necessity. It's not a luxury. They understand that. They know it's vitally important for the both physical and financial health of their families, but they worry if something major, a major illness happens to them, are they going to be able to afford the care they need? It also lowers their paychecks. A lot of the compensation that they might otherwise be getting from employers is diverted to paying for health care and keeping wages flat for over a decade. And as we all know, when you are talking about all these resources being devoted to just one sector of the economy, the healthcare sector, we're diverting it from other uses that consumers might care about, like public education and roads, you know, the usual suspects. So having said all that, I would like to actually ask you your first polling question. And bear with me while I do this. Oh, wait, hold on. All right. Poll must be closed. Okay, can you see it? Okay, thank you. I just got confirmation. So if everyone would take just a second to answer the poll, we'll find out what kind of audience I'm speaking to out there. All right, just one more second. Well, I guess that's more than a second. We'll call this one more batch of 20 seconds. All right. I want to thank everybody for voting. It looks like you're finding where you have to click. I'm going to go ahead and close the poll. There'll be some other polls later if you were unable to vote. Okay. Okay. So as you can see, almost everyone here considers themselves a consumer advocate. There's a few exceptions, and I'm not surprised. I mean, I think we're just looking at the technical definition of the word if the case where you don't consider yourself the consumer advocate. So let's look. So as you heard Amy mention, this hub is for consumer advocates. Let's talk about who that is. There we go. Consumer advocates have focused on coverage and access issues for decades, but not healthcare value. what is a consumer advocate exactly? Well, for our purposes, we're thinking what we have in mind is a person whose job it is to protect the rights of customers or consumers. For example, giving them advice, testing products, or trying to improve laws related to the sale of goods. We typically have in mind when we talk about the hub and who it's trying to serve, someone who is independent. So we're not talking about like a consumer ombudsman that might be connected to a health plan. And these consumer advocates are often, but not exclusively, representing the interest of underserved populations. So that's who we have in mind, but I can understand why almost everyone in the poll answered the poll question a little bit more broadly, because you could think of yourself as a patient advocate or someone who's on the side of consumers generally, and you want the right healthcare shopping environment for those people. So we hope that some of the material we're talking about today will be helpful to people, not only to that more narrowly defined consumer advocate that I just mentioned, but to people more broadly who just want to see good outcomes. So some examples would be like a legal aid office and obviously the folks here at Consumers Union. So thinking about that kind of consumer advocate, you already heard me talk about how they've worked on coverage and access issues for a long time, but they haven't really worked on healthcare value. It's a really difficult policy issue. And before Robert Wood Johnson Foundation made their investment in the hub, we wanted to find out if this was even something advocates would start to work on. And we held a conference in November of 2013. We invited advocates from all over the country. And it was a great conference. We had some experts to kind of do some healthcare 101 work with these people. We had a lot of interactive sessions. But what we were really trying to find out is this something you could see yourself working on? And if so, what resources would you need? We got a resounding yes, that obviously that they absolutely want to work on this. They understand the connection between the coverage and access that they've been working on for so long and the problem of healthcare value. But they said, we need help. There's all this evidence to keep track of. There's so many strategies that could conceivably be applied, and they're very busy. So the answer to that is the Healthcare Value Hub. We consider it a back office support for all those advocates who may not be able to keep up with the latest research on patient-centered medical homes, for example. So having provided you with what probably seems like a lot of background, let's tell you more about the hub itself. So what do? One thing we do for advocates and others who might want to come and look at our materials is we look at the evidence about interventions that are intended to improve value for our healthcare dollar. We try to keep on top of what's being published. We try to synthesize across studies. We try to translate it into plain language and push it out to the people who need it. But simply doing that, simply having a wonderful website with research is not enough. The other main activity we're engaged in is to personally work with advocates and to connect them to both other advocates as well as researchers, policymakers, and others, so that we can begin to change the environment in which people consume healthcare. So we consider that, an essential part of what we're doing, and the initial activity of simply monitoring the evidence is insufficient in and of itself. So how do we go about doing that? Well, like a lot of policy groups out there, we produce a lot of papers. We have a type called an easy explainer, which is designed, it's just 2 pages. It's designed to be read by a really busy policymaker or a busy advocate. We have the research briefs, which include full citations and are intended to help them navigate what the research says about a given topic, as well as teeing up what are those consumer considerations. So in addition, to take a different example, in addition to understanding what ACOs are and how they work, what do we need to have in mind as we think about making them work for consumers, or as you folks may be thinking of as for patients? We have an interactive infographic, which I'm going to be showing you. And when people, we know that our knowledge only goes so far, and so the next thing we would do is connect them to experts if they have to go and do a really deep dive in a given topic. Right now, I'd like to show you our website, because there's no better way to get a better sense of the kinds of materials that we provide. So let's see if I can do this smoothly and cleanly. This is the home page of our website. And the first thing I want to point out are these little icons at the bottom. I'm going to scroll down. This is how we have grouped the information on our website. We've examined the research around the cost and quality problems that exist. So for example, is the aging of the population a big cost driver? Well, you can find the answer under that icon. The light bulb, improving value, is where most people are going to spend their time. This looks at the evidence for and against our strategies, and I'm going to take you there. The last two have to do with specific advocacy resources, for example, glossary type of materials or model laws. And the last one is looking at all these same topics, but through the state lens. What's going on in your state? And that's of interest. Most advocates, we think a lot of the improvements are going to happen at the state level. A lot of the advocates we're trying to reach work at the state level, so they like to have their information grouped by state. So let's go inside, because if I go to this section on improving value, one of the things I can do is show you the wealth of strategies that we're looking at. In round numbers, we think there's over 50 strategies, not all of which work well, that have been conceivably teed up as something that is going to help address our problem of poor healthcare value. One of the things, so you can see that in the drop-down list, but one of the things we learned from the initial work we did with advocates to see if a center would help them is that they need an overarching framework for thinking about these strategies. So I'm going to take you to our infographic to learn more, to look at this overarching framework that we provided to them. People are familiar with bits and pieces of the concepts, ACOs, bundled payments, value-based insurance design, all-payer claims data sets, but how does it all fit together? Well, this is our effort to help people understand how it fits together. We have four broad categories. There's improving population health. What can you do before somebody is even in front of a clinician? There's transparency measures, which can have a wide gamut, and but you haven't really changed how things are paid for, the financial incentives facing everyone. There's changing financial incentives, how we pay and what we get for what we pay. And then finally, there's comprehensive measures, which we call organizing care differently. So let's just look at a couple. Let's see what happens if you click on a broad category. You see the underlying intervention that we think is in there. So here's some things that you're familiar with. There's, for example, providing prices for medical services. That's a form of transparency. What's happening down below is when you hover over a given intervention, we're signaling to the user who is the target that is who's the primary target of that intervention. Price transparency has a lot of targets. It could be information that's useful to consumers, but it could also be information useful to providers, to drug companies, and so on. We didn't color in insurers because they typically know the pricing landscape since they're the ones that negotiated all those rates. Shared decision making, on the other hand, patient activation, you can think of that as we're providing new information about your treatment options that wasn't there before, and we're doing it in a new way. Again, nothing about the financial incentives have changed, at least for the patient, but that's affecting a narrower target. Now we're really talking about the interaction between the consumer and the provider. I want to go show you a different one that might be of particular interest. Let's go to organizing care differently. One of the strategies under this intervention, because it's a comprehensive strategy that's holistically trying to change how we deliver care, is medical homes. We think the target is consumer and provider. But in addition, for any of these interventions, you don't have to just hover over it. You can click on it and see the underlying information. So this is our discussion of medical homes. We have some web-based information as well as a comprehensive report that Marcy Nielsen reviewed for us, and we're very grateful for that. So that gives you a little sense of the types of information that are on the website. I will say that we of course invite you to come here and look around. We have only recently opened our doors, and we're still building out a lot of the content. So for example, under state news, we still we have just built pages for a selected number of states. And so we're building these out as fast as we can. And one of the things you're going to hear me say later, but there's nothing wrong with repetition, is that we invite you to email us with information that you think needs to be up on the website. A new piece of state news, a new research report. I think you get the sense of the types of material we're trying to synthesize and promote. So back to the deck. We're not just a website. This is the most important point I want to make, not only to the people on the call today, but particularly to the advocates who are our primary audience that we're trying to help. We have a dedicated staff. You're not required to use the website. People can just call us up and say, I need, this type of legislation was just introduced in my state, or I need to understand this basic concept better. But I'm not done yet. As a part of trying to achieve our overarching goals of disseminating evidence out to key audiences, we have free monthly webinars. In fact, we have one tomorrow, and if you go to our events page on the website, it's on provider payment reform. It's kind of a 101 treatment. You're very welcome to sign up for that webinar. We have an advocates-only email list forum, so I'm afraid that is our strict definition of advocates, but this is a way for advocates to share, have a lively discussion in a safe discussion place. We also have a monthly e-newsletter we call the Research Roundup, where we talk about what new research and thoughtful commentary came out in the last month, and you're welcome to sign up for that, which of course you can sign up on the website. So now I'm on to, I'm kind of reaching the end of my prepared remarks, and I want to say a couple of the big themes that we talk about as we're out in the world representing the hub. One thing that I think is handy, I hope, for this audience is to talk about patient versus consumer. Consumer may seem like an odd word to use. I'm sure you're used to thinking about patients, and as you should. The word consumer is a little bit of a term of art among consumer advocates. We're just talking about people. We're talking about the people. We're basically talking about both patients and the people who might be patients one day. Maybe they're not consuming healthcare right now, but we're thinking about consumers or patients to be broadly, because we want to ensure that the overall landscape, the legislative, the regulatory, and the competitive setting in which they're consuming healthcare is the best that it can be. So the other purpose of this slide was simply to talk about, to emphasize that we have a broad lens in terms of the activities we think might help reform healthcare delivery to get some of the waste out of the system, to address some of the quality problems. It's not simply at the moment that the patient is sitting in front of the doctor. We're also looking at the legislative environment, which it sounds like you guys are too. I'd like to go out and ask you another polling question. If you don't mind, tell me how much of an impact you think consumers have on the problem of healthcare value. And I'll wait a minute. I see I have a little timer here, so I'll give you guys either 45 seconds or a minute. Let's see how long it takes. Actually, you're not going to need a minute. You're so fast. Okay. I think the voting has more or less concluded. I'm going to close the poll. Thank you for participating. Okay. So as you can see, we have a big variety of responses. Roughly 40% of you said there was a small impact, and an only slightly larger number said a medium impact, with 16% saying there was a major impact. So I'm going to show you my next slide, which will get into this a little bit. And again, I'm going to welcome questions during the Q&A about this. So we caution policymakers and regulators and others about putting too much emphasis on interventions that only target consumers. Not everyone realizes this, but the dollars that consumers touch directly, that you can affect at the point where they're consuming healthcare, also called out-of-pocket spending, is just 13% of our nation's healthcare bill. And even a portion of this is still directed by the doctor. When we look at interventions designed to influence when and how consumers consume care, for example, high deductible health plans, tiered provider networks, things like that, tiered drug formularies, what happens a lot of times is that we do succeed in impacting consumers at the point where they're deciding whether or not to initiate care. But once care has been initiated and now they're engaged with their doctor, it often follows a similar treatment no matter what, whether the intervention was present or not. So that's what I mean when I say a lot of the care is still being directed by the doctor. Another consideration is a lot of the care we consume is not actually shoppable. There was a wonderful study that came out last fall that estimated that only 1/3 of our total healthcare spending, this is non-elderly spending, is actually a shoppable service. And this researcher said that that was an outer bound, because for something to be truly shoppable, in other words, it's not an emergency, it's not urgent care, for something to be truly shoppable, you actually need good price and quality data about that service, which of course is almost never present. So think of it as an outer bound. What we don't know is what's the intersection between the 1/3 of spending that's shoppable and the 13% that represents consumer out-of-pocket. What is that number? I've actually asked some researchers to take a look at it, and if there's curiosity about it, such as I have, I'd be happy to share it back out through Amy when we get our results. So let's stay on our theme about where are consumers coming from. I've just explained that we probably don't want to assign all responsibility for changing how care is delivered as acting through the consumer, but they do have a role to play. As it will not surprise you, well, let me start it differently. Last summer, we did a mixed methods intensive study trying to figure out where are consumers coming from on healthcare costs and value issues. We did a series of focus groups around the country. We did a nationally representative survey, and we did a lit review to see what we could learn. This is the report cover you're looking at, is a 60-page report. I'm only going to mention a few things. It won't surprise you to learn that health coverage is one of the most expensive purchases that consumers make, and their ability to afford that and health care is very top of mind. Consumers are extremely worried about being able to afford both coverage and care when they need it, particularly if they have an expensive illness. They feel strongly that someone out there should be addressing high healthcare costs. They are, and this may resonate with people on the phone today, they're very interested in actually helping to move the needle on costs, but only in concert with an overarching organization. They don't feel that if they operate in isolation, just them, agitating for high costs or maybe using shopping guides, that they're going to make much of a difference. They understand, and they're correct about this, that we all have to band together if we're going to do something about costs that are unreasonably high. Obviously, not every cost falls into that category. We also ask them a lot about quality. Consumers have believe that quality is high and a lot more uniform than it really is, mostly because they probably themselves haven't experienced a quality problem yet, which is all good. It is, fortunately, the quality problems are somewhat rare in our society. But what I think the folks on the phone already know, but we're saying again, when you ask them the open-ended question, when you think of high healthcare, when you think of healthcare quality, what do you have in mind? What consumers say is more or less what a patient-centered medical home is. They talk about how it feels to be in the physician's office. Did the physician listen to me? Did I feel valued? Did I get my questions answered? They assume, so this is a nice alignment between consumers, what consumers want, and what patient-centered medical homes offer. They are assuming that there is a high level and uniform level of technical clinical competence. They never mention anything about HEDIS or CAPS or any of the ways that we actually measure quality, which shouldn't be surprising. Quality measurement serves a lot of purposes, but I thought it was worth noting. So, and here's something, this is my last slide before we go to Q&A. Before somebody calls me out on it, if you remember, I've been throwing around the word value a lot. You would be quite right if you said to me, we can't measure value. We do not have a measure that synthesizes quality and cost together to create a measure of value. So if you're trying to get to better value in the healthcare system, what are you really doing? Well, what we do is we basically try to categorize strategies into buckets, and we try to examine what is the strategy's impact on costs and what is the strategy's impact on quality. And I will completely admit right up front, our ability to measure quality is poor, and you need a lot of measures to meet different needs. I mean, that could be a whole webinar. In fact, I'm sure you've had webinars on that topic. So I just want you to realize I'm not being naive about it, but of course it's just a single slide. And so we think about, are there interventions that either maintain or improve quality while lowering costs? If we encountered an intervention that raised costs but improved quality, we would certainly want to consider supporting it. You just have to make a judgment call. If a strategy lowered costs but it also lowered quality, we probably want to reconsider it. This is self-evident, but I think it's always good to keep in mind that we actually don't have a measure of value, and what we're really talking about is trying to bucket things. So let me stop there. And turn it over to Amy, I believe, to tell me what kinds of questions might have come up in chat that I could address.
Well, thanks so much for this great presentation, Lynn. I think everyone's going to have a great time after the end of this call, spending a lot of time really navigating the hub and learning more about what's available and all those great resources. Just a quick reminder to everyone, go ahead and type in your questions. We'll have a few minutes to talk with Lynn about some of the comments that have come in. We've got a few of them rolling in now. So even if it's not a question, if it's a particular comment, or if you know of some places where they're doing a good job of presenting information about cost and quality to patients, please do send us that information. We've heard that there are more and more efforts that are ongoing in different areas of the country that really are trying to get this information into the hands of consumers. Not so much, it seems pretty scant so far on the primary care side of things right now, but certainly among hospitals. Lynn, do you have any sense of how often patients really are looking at data that is a little easier to find now? Jeff Harris, who works with us and is one of the leaders here at the PCPCC, he points out that, there is more public reporting of, infection rates at hospitals, readmission rates, that kind of thing. Do you have any sense of how often patients are really using that information to make decisions about, let's say, elective surgeries or procedures that they might want to have done?
I do. Unfortunately, I think so as you have correctly pointed out, there's just an absolute wealth of information about prices and quality that was not there in the past. The evidence seems to indicate that this is still rarely being used by consumers, and I'll give a couple examples and then a helpful note. A group called the Catalyst for Payment Reform, which does some work, it's sort of similar to the Hub, but its main constituency is large employers, surveyed health plans, and they found out that 98% of them have pricing tools for their enrollees. So that's pretty universal, and only 2% of the enrollees are using those tools. And that doesn't totally surprise me. In our focus group work, and not just the ones we did last summer, but the whole time I've been here, consumers are somewhat skeptical of particularly quality measurement. And the reason is it has to come, first of all, there's a lot of quality measures out there, and they don't always agree. Think about hospital quality rating systems. They can provide very different results for the exact same hospital. So consumers may have maybe a bit justified in being skeptical. The other thing is they're distrustful of this information, and there's two dimensions in particular they have in mind. They really want to know the messenger. And if the messenger is not a trusted source, and I will say modestly, Consumer Reports is a trusted source, but if it's something they haven't heard of, like Leapfrog, they may not give weight to the information no matter how correct it is. The other thing they're looking for is they want to know that that rating or that quality measure is from people like them. They are very worried that somebody else's assessment might not be how they would perceive that provider or that set of treatment options, or how they would weigh a set of treatment options. And that's why you see consumers basically often ignoring this carefully calibrated and collected and reviewed quality measures, and instead turning to their neighbors and saying, who recently got a knee replacement and who did you use? Because that neighbor, this is just human nature, that neighbor is someone like them. They place more confidence in what that neighbor reports. Having said all that, I think that in the future this will change. I think particularly as younger generations grow up and become healthcare consumers, I think we can get to the point where we have developed trusted measures that people are willing to use. I think we've seen it in other markets, and that we can get to that point, but I don't think we're there yet.
What about on the hub? Is the hub, does it currently, or do you plan for it to link to places in communities and more particular marketplaces where there is good consumer information that's available?
No, yes and no. The hub would include evaluations that we would talk about. Somebody put information in front of consumers, there was an evaluation, and here's what they learned. Either that it impacted how consumers consumed healthcare or it didn't. That's because our constituency, again, is the consumer advocates, not your everyday consumer on the street, helping them to advocate for the interventions that really help and really make a difference. But having said that, my larger organization, Consumer Reports, absolutely would do something like that. So anyway, you could expect to see that on their website.
Excellent. So there's a question that's being asked around the role of the purchaser of healthcare. So not the consumer, not the patient, but the employer, the health plan. What's their role in improving cost and quality and influencing a lot of that? And then what's their interface in this between the actual consumer and the providers?
So they have a very important role to play, and the larger the payer, I'm going to use the shorthand term to refer to whoever, to the large employer, whoever's paying those bills. Well, basically, the person who is selecting the health plans or the set of health plans that are available. The larger the payer, the more responsibility they have, because the more leverage they have to insist upon strong, leading edge efforts with the provider community to ensure that we are using everything in our tool set to bring better value to consumers. Something that we see, so employers have a strong incentive to control costs and an incentive to keep their employees happy. But the way that has manifested itself in recent years has often been things like high deductible health plans. High deductible health plans are a quick and dirty way to transfer more of the spending on the shoulders of consumers. But the evidence is extremely strong that just because they have skin in the game, if you'll forgive that expression that I don't really like, that doesn't mean that the consumers are making wise decisions. There is pretty much no evidence that they can pick and choose. They can distinguish between high value and low value care. For example, consumers in high deductible health plans, they cut back on care, but they even cut back on free preventive care, the preventive care that has no cost sharing. So because of what the evidence says about that particular intervention, I would say these large payers that use it are being lazy, and instead they need to work with their health plans who in turn need to work with the providers, whoever is directly negotiating with providers, to look at a much broader array of interventions and more nuanced interventions that are more likely to move us into that value space where we want to be.
Thank you, Lynn. So there's a question about how you envision case managers or care managers might use the hub, not just for their own work, but for also the patients that they're working with. Do you have any suggestions for them?
Yeah, so the first suggestion would be, we are all about the evidence. So if you're aware of an evaluation that shows good or bad, how greater reimbursement for case managers affects outcomes, affects overall costs, we want to see it, and we want to make sure people can find it when they come to our website. If you're on the ground and you see, you can see what needs to be changed about the way we're bringing care managers into the delivery team, and maybe the evidence doesn't yet exist. That's a research gap, and we want to know about that too. Because of the fact that we're working so closely with researchers and we're working closely with funders, we have the ability to bring research gaps to their attention and say, this needs to be studied. We need an answer to this question because there's anecdotal evidence suggests that this could improve the care that that patients are receiving. Again, we're not really in the business of providing consumer-facing materials. That would be the hub, and that might have been what the questioner had in mind. But that is something that at Consumer Reports they might be doing. So I guess I welcome the questioner to be in touch with me if that's what they had in mind, and I could maybe help direct them to what Consumer Reports provides. I don't think at the moment they provide exactly that type of informational material that you would actually give to a patient, but I could be mistaken, so I'd be happy to check on that.
Yeah, and it sounds like Consumer Reports might be also the place to go to in helping devise some portals or some information for patients so that they can really figure out, not just based on information related to, what the hospital's reporting around, whatever those particular quality metrics are, but also allowing for patients to consider their own personal preferences. So, whether it's because, a particular trusted doctor works there, or whether it's because they provide an additional service that's important to their cultural needs, et cetera, et cetera. I could see a lot of different kind of filters that would be of interest to patients if they really are have the ability and the capacity to drive their healthcare dollars and make those decisions on their own.
Absolutely. And there's lots and lots of effort to get these, web-based decision-making tools in front of consumers. But I think we have a lot to learn about which ones will be effective. So, but it's the direction we're going in, and I think we'll see some success down the road, particularly if we really pay attention to how consumers are using them as opposed to just, guessing and putting them in front of consumers.
Yeah, and I think you're right. I think there really are some innovative things happening around the country. One of our participants said that there's some great conversations going on in Fergus Falls, Minnesota on healthcare, and healthcare costs with the help of the Institute for Clinical Systems Improvement. I know that there's some work that's being done in Wisconsin. There's a project going on in Cincinnati. So I think people are taking this very seriously and really responding to the desire of consumers to have more transparency and more information about the healthcare services at large. One of the things that we certainly still sometimes struggle to do is to get the message out to consumers about the role of the medical home. So we're so pleased to work with you on the information that you've included in the hub, because oftentimes patients don't quite understand, one, the vision for what we're hoping for primary care, but then even if that care in and of itself might require a larger financial investment by employers and payers to really transform the way that care is delivered, that we really are seeing evidence that it does improve quality and drive down costs on as a result of that more comprehensive primary care up front. So we still have a long way to go in helping consumers understand that and then make wise choices when they're able to around those issues.
And if I could add one thing to your observations, in these places around the country where you're having in-depth conversations, you mentioned Minnesota, Wisconsin, Cincinnati, keep in mind from that focus group work I mentioned previously, consumers are very anxious to be organized as part of a larger force for change. And using the right process and the ability to create the critical mass that you need, those conversations could turn into what do I want to say, a movement, an organization, a collection of people that truly are, helping, so we've engaged the regular consumer. So always keep that in mind as when you're having conversations with these groups. Is there a next step that can be taken where they continue to actively work for change?
You're absolutely right, and certainly consumers and patient advocates are much more likely now to ask for a seat at the table as those programs and policy changes are starting to be recommended and developed. The PCPCC recently signed on to a letter that's going to HHS Secretary Burwell saying, oh, we're so excited about the Learning and Action Network that's being developed to help drive the healthcare system into more advanced payments, but we need consumers at the table. We need patients at the table in helping devise those policies and those regulations and actions that will help move our system to more comprehensive payment. So you're absolutely right. I think that we're not only our consumers having that seat at the table, they're demanding that seat at the table, and health professionals and payers and everyone else that's part of this environment has started to understand that they end up with a better product when they have done this work in partnership with consumers and patients from the very beginning.
Well, you just warmed the cockles of my heart.
Well, I think that might be a good place to wrap things up. Thanks so much for everyone who participated on today's call. These slides, along with the audio, will be available up on our website within 24 hours. So for your colleagues who were not able to participate on this live call, please do forward the link to them. If you have any other additional questions for anyone here at the PCPCC, or for Lynn, you can email those to me at agibson@pcpcc.org, and we'll make sure that those get answered. So thanks again so much to you, Lynn, and to everyone who participated, and we look forward to talking with you on our call next month.
Thank you for having me.
Bye-bye, everyone.